This is a very important occasion for men and women. What we are seeing now, knowing fully well, men are, what is happening now, it used to be a very secret. People don't want to disclose what they are suffering from. But these days, with technology, and people trying to be aware, make it available to everybody to know how to take care of ourselves. Now, let me get back to my question. Looking at the statistics of what is going on now, can we look at the trend of incidence of both ovarian cancer, breast cancer, and prostate cancer? Is the trend going up, say, in 10 years? What level are we going to expect? Or is it going down based on being aware of how to handle it? Anybody in the panel can take care of this. Thank you.
7% for those periods. So, despite the fact that they haven't found a cure, but there's a lot of effort towards finding a definite cure on cancer. But the trend and the percentage of improvement, technology, medicine, which is one of the things the ASA women is raising awareness for, because they want to make sure that we're able to provide that opportunity for women in Nigeria and in Africa, so that together and all over the world, the breast cancer will not only kill women in Africa, but save women in America. So there has been some improvement, but we want to make sure that it's worldwide. Thank you.
What are the symptoms of ovarian cancer and cervical cancer? Are they different? Thank you.
To look out for is if you have bloating that's excessive when you're eating, if you get full easily, that can be a symptom. Sudden dramatic changes in your weight, so sudden weight loss that's very dramatic can be a symptom for ovarian cancer. But really, like I said, this kind of ties back to earlier in my talk, is that going to your OB/GYN for annual pelvic exam, that's actually something that they can evaluate for on your pelvic exam, because if they feel like a large mass in their exam, then we can do an ultrasound to kind of further evaluate that. So ovarian cancer is pretty hard to diagnose because there's no good screening tool. Symptoms for cervical cancer, if you have kind of similar, so dramatic changes in your weight, any irregular bleeding. So typically when you have a period, it's once a month, but if you're having irregular bleeding, you could actually be bleeding from that cervical mass. So again, going to your OB/GYN for a pelvic exam so that someone can actually evaluate and look inside and see if there's anything abnormal is really important.
Cancer, is there any relationship between heavy bleeding? Because among us women, we know that some of us have heavy bleeding. My sister, the one that I talked about, she had heavy bleeding as soon as she had her first period. So are there any relationship between heavy bleeding and cervical cancer?
So not between heavy cycles and cervical cancer, but heavy cycles, there's many things that can cause heavy cycles. Fibroids, I'm not sure if anyone's familiar with that, but that's very common amongst Black and African women. And that is often a common cause of heavy bleeding during your menstrual cycle. Bleeding, particularly related to cervical cancer, is not a direct association, but any sort of abnormality in your cycle does warrant just general workup from your OB/GYN doctor, because it could be several things. And at the end of the day, we don't want you guys to be bleeding heavily, because that affects your blood count. You can be anemic, which has other health implications. So any sort of irregular bleeding definitely needs to be addressed by your doctor, but it's not a clear relationship between the two.
We had this opportunity to gather together and talk about breast cancer, cervical cancer, and happy to see that I wish we have more people here, especially our youngsters that are like untouchable. My question is on self-examination in order to get to know if you have breast lump before you go ahead and spend money on mammogram or that. Now, in relationship with our menstrual cycle, I am a nurse, so I know what's supposed to be done, but I just want the doctor to expatiate more on it. At what time in our menstrual cycle are we supposed to do this self-examination? Is it just right after our period flow, our menstrual flow, or just that's special when and when is the right time to do it? Thank you.
Cycle has gone down, so when you ovulate, you can actually have symptoms of breast pain. You can have like nipple discharge during ovulation. So examining, self-examination while you're ovulating, which is about 14 days into your cycle. So if you have a 28-day menstrual cycle, 14 days after your period was about the time in which you ovulate. So I would not recommend examining during that time because you can just have symptoms of ovulation. And then same thing when you have your cycle, you can also have symptoms of breast pain, premenstruation symptoms as well. So after your cycle has passed, I would say would be a good time for self-examination.
Thank you so very much for this powerful presentation. I love it. I know for sure, based on statistics, that or statistics indicate that this prostate cancer is the second leading cause of death in the United States of America, and aside from skin cancer, which is the number one. I'm trying to get things very specific. We know about in the United States of America, and I know most of our projects here that we're trying to do is geared towards Nigeria or something like that. So I would want to get the statistics of this prostate cancer for Nigeria. That will be my question, the response to that will be very high. I really need, if that will be done, if it can be done, or just to get the Nigeria specifically, how many or whatever it might be, what the outliers or whatever might be in that would be great. If anybody can shed a light on that, that would be so very great for me. Thank you.
But that's something I could definitely look up. I'm not sure if anyone else on the panel is familiar.
For the other dog, what does he do?
Okay, do we have it?
My gynecologist told me at a certain age, you do not have to do cervical cancer screening. Is that correct? And what age is that, please? So I know as I'm getting older.